of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. Hi, Kiki. So have any of our members reviewed the minutes, and do I have any comments on the minutes?
No comments. I vote to approve.
Second. So if there are no objections, we can approve the minutes for our September meeting, and I want to thank Alex, as usual, for his very careful recording of the meetings and the effort required therein. So thank you. I don't really have any organizational issues to go over tonight. We have lots and lots of dense action on the schedule, so I'm just going to go past that. From a community infectious diseases follow-up, I'm going to try and just buzz through that. I am not aware of any significant outbreaks of localities near us, either for COVID or flu right now. I will point out that I had my influenza inoculation today, and I recommend everybody who is eligible and not contraindicated, go ahead and get your flu shot. We're getting to the time of year where it's really time to do that. With regard to other inoculations, you should consult your healthcare professional. And with that, I'm going to turn to the food inspection practices item on our agenda and ask Alex if he has any updates or reports.
Well, I'll be brief because we have representatives from the county here tonight. I will note that over the summer, I had not been submitting reports. I've just gotten caught up but did not get them done in time to submit them for the agenda, so those will be submitted for the next meeting. The kind of biggest thing I did notice in the reports is there seemed to be, I don't know if I would say an unusually high number, but a higher number than I would like to see of businesses who are basically getting dinged on the very first item on the inspection report, which is having a person in charge who's a certified food protection manager. And I think some of that is that there was an issue with the farmers market not having somebody at each stand, since each stand is considered an individual establishment. I did note that in the reports there was a note that they have scheduled a training for, I believe it's this Friday, sometime this month. So hopefully that will resolve that, and that was a large piece of what was going on there, but that is something for our establishments to be aware of, is that they need to keep their certifications up to date, and there needs to be someone on the premises at all time who's ServSafe manager certified.
So is there any no action required on the part of the board? It seems to be something that is rolling into a better place on its own right now.
Nope, just information for the community.
Great, thank you. All right, so let's move on to, we have several items that are listed as old business, but it never gets old. And the first would be an update on the township addiction education from our township, our school district representative, P.T. Kevgas, a newest member. So I'll turn it over to you and your team.
Thank you. Come on up, ladies. As they're coming up, I want to thank you for welcoming us this evening. I'm here to introduce our district nurses. Let's see, we have our nurse coordinator, Maureen Lorario, Steffi Grabowski, who is our nurse at the high school, Jen Moffitt from the middle school, and Winnie Murray from Ithan. So thank you, ladies. In addition, we have Mrs. Roslin, who is one of the best teachers I've ever met. She is health and PE at the high school and also our department chair. And then finally, certainly but not least, we have Nadine Carroll with the Caron Foundation, who's been working with Radnor Township for close to 20 years. This is
thank you all for coming.
Definitely the A-team. So one of the things I've always said is that while I haven't had any experience in another district, I know how incredibly lucky we are to be in Radnor Township and to have the abundance of resources that we do. I always have felt that we are tremendously blessed. As lifelong learners, it's our nature to reflect and evaluate our tools and resources to ensure that we continually have the best supports for our students, especially if and when those needs change. Which brings us to why we're here tonight. You'll hear about the robust supports and programs we have for our students in the township, or in the district rather. And to begin, I'd like to invite Mrs. Lorario up and our nursing team to share some of the programs that we have in place.
Hello, I'm Maureen Lorario. I am the nurse coordinator for Radnor Township School District. I've been with Radnor for 15 years. I want to let you know that we have 10 nurses in our district. We have 6 certified school nurses. We have 4 staff nurses. We have, as PT said, we have the A team. And we take this very seriously. I mean, as serious as a heart attack. We take this seriously. So we are all trained, all the nurses are trained via PADOH Narcan training. All our nurses have Narcan in their offices. Our trainers have Narcan. At the beginning of every school year, our nurses do training for the following: safe administration of an EpiPen, what to do if a student is having a seizure, and how to safely administer Narcan. That's how serious we take this. Our nurses also review the signs and symptoms of an opioid overdose with our faculty and staff on a yearly basis. All medications are secured in the health office. If a student has an EpiPen or an inhaler, they would have to have a doctor's note to self-carry. This complies with our school board policy 210, use of medications and administration regulation 210. I just wanted to make sure that you know that we are aware of what's going on, and we are very, we're ready to go. Thank you.
All right, so I'm going to ask Mrs. Rosen to come up next. She's going to talk a little bit about our health programs at the high school and the middle school.
Just a little bit, right?
Just a little bit.
Oh, I don't
Yes,
know.
we only have a few minutes.
Okay, so our 9th grade health classes touch on current substance abuse trends. 10th grade gets the bulk of it, though. They have a unit on understanding and avoiding hazardous substances, which includes tobacco, alcohol, and all drugs, prescription, over-the-counter, and illicit drugs. In this unit, of course, current trends with vaping and the opioid addiction are also covered. Nadine Carroll, the best, from the Karen Foundation, also works with our health and phys ed teachers to keep us up to date and informed about what's going on in Radnor. And she also comes into our health classes and she discusses current trends, including vaping and the opioid crisis. Our health and phys ed teachers have Narcan trainers for our classes and show students how to use Narcan. The training is not only discussed once, it's actually discussed twice in our curriculum. It is covered in the drug unit as well as our first aid and CPR unit. In this unit, our students are trained in rescue devices and life-saving procedures that include EpiPens, Narcan, Stop the Bleed, AED, and CPR training. Our students will receive a certification of completion when this unit is finished in 10th grade. All this information is great, but obviously means nothing if our kids are not equipped with skills to make decisions. So we obviously, it's a huge part of our 9th and 10th grade curriculum is the decision-making process and how to advocate for themselves and others. We feel that knowledge is power, and giving our students all the information is key to their decision-making process. And then lastly, just something that is on the horizon, we are being trained on November 7th by the Radnor Township Police Department. They are going to come in and inform us and keep us up to date on all the chemical choices that they are seeing, which will only increase our knowledge and obviously enhance student learning.
Good evening, everyone. I'm Nadine Carroll. I'm a student assistant specialist with Karen Treatment Centers. So Radnor is contracted with Karen for the last 15 years, so since 2008. And when I started, that was at just a day and a half a week. But in the next few years, we kept expanding the contract just based on need and programming. And so for the past, I'm not sure, 7, 8, 9 years maybe, it's a 5-day-a-week contract. So I'm in the district 5 days a week, primarily at the middle and high schools, working with the students, also work with families, caregivers, and staff. I sit on the middle and high school SAP teams, and through the SAP teams, I'm the assessor for the district. So I'll do the comprehensive behavioral health assessments. That's for students in grades 5 through 12. Also run a number of psychoeducational support groups at the middle and the high schools. But then in terms of our drug and alcohol programming, Radnor really looks at the PAYS survey to really kind of determine what our programming is. And we really are constantly reassessing that. So PAYS is the Pennsylvania Youth Survey. It's administered every 2 years, and you may all know this already, but students in grades 6, 8, 10, and 12. This is an on-year, so our students are set to take it this fall, and then in the spring that data is released. And so what we typically do in the spring is that I'll take that larger report, it's a huge report, but we'll kind of pull out the areas where we're really seeing some areas of concern. So any substances where our student use numbers have increased from the past survey. We also compare those numbers against the state and national averages, so we're really looking to see, what areas we need to focus on, as well as what's going well and areas, where students may not be using much. But we really take all of that, put it into a report that's presented to the school board. We take it back to the administration teams in our buildings. We take it to our health and phys ed departments, our SAP teams, and we really use that to kind of talk about, okay, how is our programming? What do we need to improve? Where are we good? What do we need to enhance? And so some examples of that, several years ago when we were really concerned about vaping and we saw those numbers in those PAYS survey, we really focused on education. I went into health classes 7th, 8th, 9th, and 10th. We worked with the health and phys ed departments to really put that into the curriculum. I've continued to go into the middle school health classes this year, with Amy and the rest of the department. I'm going to revisit those 9th grade students and just really reinforce when they're at that unit and talking about vaping. I provide a Project Connect group, which is a nicotine reduction and cessation group. I also do teen intervene sessions, so that would be for individual sessions for students who are struggling with substance use or abuse. We can provide marijuana brief intervention sessions, so again, focusing on teen cannabis use. I could do a group based on the need, if there's enough, to again focus on reducing or eliminating use. And as Amy Roslin also mentioned, this year I'm going to also be going into 10th grade classes and focusing on the opioid crisis and really, again, enhancing what's already in the curriculum. So I think that's a hopefully brief overview of the supports and some of what we've been doing.
Thank you all. I just want to reiterate for a second, and I'm going to embarrass Mrs. Roslin. Sometimes we don't think the kids listen, but they do, right? And so again, I think it goes back to the education piece, which is most important always for us as educators, obviously, but also helping them to make good decisions, because there are so many bad decisions they can make. And there are so many things that they come up against at such a younger age now, whether it's social media, whether it's peer influences, whatever it is. Mrs. Roslin was awarded Teacher of the Year. See, I told you I was going to embarrass you. And I won't quote the letter, but the essence of the letter was how the student remembers the lessons that she teaches in her class about decision making, and hears that in her head, not in a creepy way, Amy, but in a way that reminds them, right, to really stop and think about what they're doing. And if we can make that difference, hopefully we're setting them on a good path. So thank you. Thank you, everyone.
Thank you. Thank you.
Oh, before you go, thank you for a remarkable job of giving a lot of information quickly. I'm sure some of the people on the board have some questions for you when they're done. I certainly have a couple. Anybody have questions?
Well, I'll just very quickly echo what Panayota said about Ms. Roslin. She's an excellent teacher. I'm a graduate of her class, so I'm very happy that she's here tonight.
She's being roasted.
So how many Narcan events do we see in Radnor Township school districts in a year?
I'm going to knock on every piece of wood here. I don't even want to answer that question because we've been blessed not to.
This is a question you'd like to bang me up the side of the head for asking? Is that-
Yes.
And that leads into like part B of that question. Is the opioid crisis in Radnor Township school districts?
I think that's best answered through the data, and I think we're administering the PACE survey actually in about a month, and we'll see. Up until this point, we have not seen that.
What's the name of the survey, please?
The PACE survey, Pennsylvania
Pa-
Youth Survey,
Spell that for me.
PAYS.
PAYS, PAYS survey.
Yep.
So how come you don't do that every year instead of every other year?
So they do it in grades 6, 8, 10, and 12, right? So they allow for a little bit of growth and look at the cohorts every 2 years to make sure that we're getting accurate data.
So from a research point of view, I can understand that for data integrity that makes sense, but from a point of view of the public health service aspect of it, if you did it every year, would you get any more information out of it that would be helpful or no?
I'd let Ms. Carroll answer that. I think that she's the one that analyzes the data. I don't know if we would.
And it's only administered every 2 years, so it's not our choice to only
Right.
take it every 2 years. It's the only option. In terms of why it's only administered
Right.
every other year, I can't speak to that, but I do think it's been, we do look back at, we will at 2021, 2019, 2020.
Can you step to the mic? Sorry.
Sorry, yes, absolutely. So just to repeat, it is only offered every 2 years, and that's the state survey. And just that I don't know how much more information we could get year to year. It could be really helpful, but we do have our data in our district going back, right? So we have 2021, 2019, 2017, and we pull together our reports. We take those past reports and really compare year to year.
And I'll just jump in as well, and that's not the only data that we do use. So I know that you mentioned the SAP team. For those of you that don't know the acronym, Student Assistance Team, program rather. So we look at those statistics as well, right? What we're seeing with the students that are referred to SAP, whether it's a drug problem, whether it's an issue with emotional issues, mental health, whatever the case is. So we have that as data as well. We look at trends in attendance. We look at all different pieces of data to make sure that we're accurately representing what our kids are dealing with.
So I want to congratulate you all on a really well-rendered presentation that I'm confident is representing a really well-rendered system within the school, and thank you for all that you do. So the biggest question, so what don't you have? You got a lot of resources. Most school districts would be just thrilled to have those resources. What are you missing? I raise that because one of the things that the county, we'll be hearing from them shortly, was looking at when they did a public session here in town is apparently there will be some funds that become available from the opioid settlement. Thank goodness we now have a county health department because it will be administered from the state through the counties. And if you had a wish list, is there a grant that you would apply for? What would you want to have that you don't have now that would be helpful?
So at the high school, and that's my lens, right, for the past 20 years, we have 2 psychologists, right? We have 2 mental health clinicians from Lakeside, right? And that came out of a need that we saw when COVID took place. We've got a dedicated nurse. We've got 7 school counselors, right? We have an abundance of resources, and Ms. Carroll on top. At this point, right, I would have to give that some thought. One of the things that I would say is that I know the high school is looking to have conversations with our students, right, about the culture of the high school, about what's going well, what's not going well. We did a survey last year as well, and I think it's important to hear their voices in this conversation to see what they think we need as well. So I would defer that answer for now.
Thank you. Thank you very much for coming in. Thanks for a great presentation.
Thank you. Thank you.
You didn't give it to Ian? Oh, okay. He's in the back, so you may want to run back. So our next agenda item is from our Delaware County Health Department update, and we have 2 guests, our presenter Samantha and our long, dearly held Radnor Township Health Officer Marie Carbonara, who I'm absolutely thrilled to see, and welcome to both of you, and thanks for coming.
Well, thank you so much for having us. My name is Samantha Cooper. I'm an environmental health specialist with the Delaware County Health Department Environmental Health Division. I'm going to provide a brief update on the inspection progress for 2023, specifically in Radnor Township, as well as a brief overview of our services offered. So the overall vision, mission, and values of the Delaware County Health Department is to provide all members of the community with access to the resources that they need and to provide opportunity to lead a healthy and productive life. Our mission is to promote, protect, and assure conditions for optimal health for all residents of Delaware County through leadership, prevention, response, and partnership with the community. Specifically in the environmental health program, we have different services that we offer at this time, including food safety, public bathing places, organized camps, campgrounds, and mobile home parks. We also visit all of the institutions within Delaware County. We have a mosquito-borne disease control program. We also do inspections of on-lot septic and wells. As part of our key services, we do license and inspect all of those different categories, as well as investigate public health nuisances and provide educational resources and presentations. In Radnor Township, we have a total number of 273 facilities. In 2023, I have completed over 450 inspections. 94% of all routine inspections have been completed for the year, and 98% of all facilities have been licensed, registered, or certified per the Delaware County Health Code. All right, so we'll start with our public bathing places. Public bathing places are our pools. Our current services include inspections and permitting. We document and investigate all complaints reported to the County Health Department. We monitor and report abnormal lab results to the facility owner or manager within 24 hours so that they can be corrected. And we also provide an educational approach towards compliance. We do that across all of our services to maintain compliance with the Pennsylvania Bathing Code and the Delaware County Health Code. In Radnor Township, we have 22 public bathing places. 100% have been inspected and registered. For 2024, we are hoping to make improvements to our application process and receiving the initial lab results. To open your pool for the season to the public, we do need to receive a lab report stating that no coliform bacteria has been detected, as well as chlorine and pH levels are at the required levels. So we're hoping to make sure that those get in earlier to make the process a bit more seamless on both ends. For our institutions include daycares, hospitals, nursing homes, long-term care facilities, as well as our schools. We currently offer inspections and certifications in regards to the Delaware County Health Code. We respond to all complaints reported to the County Health Department. We strive to do that within 24 hours. We also document and investigate all communicable disease outbreaks within those institutions that are reported to our department. In Radnor Township, there are 32 institutions. At this time, we have 66% of all routine inspections completed for the year. 90% of all the institutions have been certified. And for 2024, we hope to increase the inspection numbers to twice a year. You may think that the routine inspection number is quite small compared to the public bathing places. That's simply due to the season. Our pools have opened and closed for the year. Our institutions are just now reopening, a lot of our schools especially. Schools, daycares are beginning again for the academic year. In terms of food safety, that is truly the bulk of what we do. In terms of our services at this time, conducting the inspections, issuing the licenses, documenting, responding to, and investigating food safety complaints, potential foodborne illnesses, and all outbreaks reported to the County Health Department. We provide public access to all inspection reports, so at any time you can look on your phone before you go into the restaurant for the evening, see where they're checking out for the year. We provide an educated approach to compliance as opposed to an enforcement approach. That allows for the facility owners to be able to correct their violations and correct employee behaviors as opposed to going in and wagging a finger. At this time, we conduct at least one inspection annually at all retail food establishments. We also review plans prior to construction, remodeling, or alteration of all retail food establishments. In Radnor Township, at this time, there are 219 food facilities. 94% have been inspected for the year. 98 have been licensed. And for 2024, we do hope to increase those to twice a year. All right. If you have any questions at any time, or if you'd ever want to report a foodborne illness, a complaint in regards to food safety at an establishment, please reach out to our wellness line. It is available 24/7 to take your call. They are then forwarded to the environmental health specialist assigned to the geographical area for which the complaint is for. Any questions?
Thank you very much for the presentation. I really enjoyed it and learned a lot from it. In one category of inspections, I think it may have been institutions, you mentioned that the goal was to increase the percentage of them. And understanding how hard the department is working, I'm just wondering how that would be accomplished. Is it a matter of stepping up the frequency at which they're required, or getting new staff to do that work?
Yeah, so I'm sure you saw on one of the first slides that the number of inspections that were conducted is over twice the number of facilities that are within the area. That's because we have a lot of re-inspections following up on facilities that are out of compliance. We're hoping that with the educational approach that we're taking to these inspections, they will decrease because facilities will be in compliance on their first routine inspection. That'll allow us to move quicker through all routine inspections. It's also prioritizing that, so making sure we get into those facilities twice a year as opposed to holding those until the school year begins again.
I have a completely ignorant question. What's the mechanism for enforcement of non-compliance? So, food institution, you go, there are violations, you give them instruction on how to respond to those violations, you go back, that's unaddressed and there's something new. What happens?
Yeah, so again, it's a lot of education and explaining to the proprietors the importance of doing things per the code. The code isn't arbitrary, it's for safety, for the safety of their employees, for the safety of the people that they serve. So we do have re-inspections. So the first inspection, like you said, something's out of compliance, go back, something new's out of compliance. We can bring them up and go to a third inspection. Once we get to the third inspection, we do begin fees. The fees do encourage compliance. It is over $300 for a third and subsequent inspection. If there is an imminent health hazard, the next plate of food that may leave that establishment could make a person ill, a closure order can be issued. Closure orders do not have a maximum period of time in which they could be closed. They must bring the facility into full compliance in order to be reopened.
Who closes them down?
So that is, I would need to identify the imminent health hazard and then have supervisory approval. So it's a double check.
So you do, though, or do you involve law enforcement at the township level?
No, at this time we do not involve law enforcement. If we would ever have someone who is hostile, we'd be happy to have them come in as well to assist. I do come from the Philadelphia Health Department, and I'm not unfamiliar with that.
Do you experience hostility, or are you welcome in the community?
No, generally, I personally have not experienced much hostility within Radnor Township. I'm very lucky to have inherited in an area that was under good control with the previous health officer. And in general, they have seen the benefit of having routine inspections because Radnor Township already had a robust program in place. Even the past week, I was investigating a foodborne illness, a slight hostility from the business owner to get started. Explained, I'm not accusing you, I'm doing my job, investigating. By the time we left, we were laughing, joking, and he said he appreciated us coming out because it always fine-tunes their operations.
And on that point, I will also just say that I did a ride-along with Samantha, so I've seen how she does her inspections. And there is, in addition to, of course, the science of the food safety, there is also an art to dealing with the business owners, and she's very good at that.
Thank you.
So is your territory across the entire county? Are you Radnor only, or?
So our inspectors are assigned geographically for efficiency. So I am the primary inspector at this time for Radnor Township. However, because we have a county health department, there will never be interruption to services if I am reassigned or otherwise unavailable. If I take vacation, you still have an inspector available to you. You have several other inspectors available to service any complaints, foodborne illnesses, or emergency responses.
Well, so thank you for the very impressive presentation, and it feels like our environmental health services under the county have continued seamlessly from the excellent services that we had when we provided them for ourselves. My understanding, secondhand, is that not every township in the county has gotten on board. Can you give us an update on where the rest of the county is in that regard, or is that outside of the remit?
That's correct. At this time, there are 7 townships that are involved in an injunction where we do not, at this time, provide services.
You're not willing to comment on ongoing legal cases? Is that what I'm hearing?
I am not authorized to speak.
All right, thank you.
Thank you.
Any other questions? Well, thank you very much for coming, Samantha and Marie. It's great to see you. Thank you both.
Thank you for having us.
The next item on the agenda is Bob, who I don't see and haven't heard from, so I have to punt that to our next meeting. PT, I just Bob had the idea of having the oral health truck come for programs, oral health education and information. This happened close to a year ago, and he spent months trying to get it up and going. He was meeting resistance at the level of some of the schools because the notion was it might take place at the school. So I'd like to roll you in and involve you if he still has the energy to do the heavy lifting there and see if we can't get that ongoing. So when Bob is back, I'd like to get the two of you together and see if we can't get that off my damned agenda.
We can certainly discuss it.
Great.
No promises. It's a pretty packed calendar as the year gets started. So I think if any resistance was seen, it's probably because there's so many programs in place that are already established month to month.
Gotcha. Thanks. And with that, next item on the agenda is our student intern program, and I'll turn it over to our student intern program team. Alex, you want to take over?
Yes, so I'll take over to hand it off. At this point, our 2 student interns have been selected. We have Chloe and Finn here tonight. Congratulations to both of them on getting selected. In a minute, I'll turn it over to them to introduce themselves, but in the meantime, so we have Lisa is going to be working with Finn on a project that she'll introduce, and then Lisa and Julie are going to be working with Chloe on a project that they will introduce. And do we want to have students introduce themselves first, or?
Sure.
Okay.
Could just say year, name,
Yeah,
how
just
long, if you lived
very
here all your
quickly.
life, very brief, your interests.
Yeah. I'm Finn Ryan. I'm a senior. I've lived in Radnor my entire life. I went to Radnor Elementary School, and now I'm at the high school. And I would say my interests mainly lie kind of at the intersection between humanities and health. So I'm very interested in public health, but also kind of how storytelling and English plays a role in that too. Thank you.
Hi, I'm Chloe Fong. I'm a senior at Radnor High School. My interests include global health, public outreach, and leadership, and I'm really excited to be working with Dr. Bannister and Dr. Kohler.
I'll jump in for a second because I know these two well. I can tell you, you could not have picked two better students to represent. They're phenomenal.
So I was not involved in selection as my oldest daughter is also a senior at the high school. But I'm very excited that Finn was selected to be my intern because I've known him since he was 3, 4, 5 maybe. So we have not met yet because I was out of town last week to discuss project, but the introduced project was to kind of look at bike rack availability and paths in the district, kind of getting information from Public Works, what's the number and availability, because if we're looking for a public health factor and we're trying to encourage bicycle use, we'd want to make sure that we're allowing enough availability of resources.
Okay, so I was very involved in the selection process, and I will say that our students, we are so lucky, and it was an embarrassment of riches to look through those resumes and just to see how amazing all of the students were that applied. So Dr. Kohler, so Julie and I are going to be having Chloe as our intern. We're really excited to work on the proposed project of looking at the different levels of care of mental health, kind of spanning from the inpatient level of care all the way down to outpatient, and differentiating between those levels of care, as well as to identify some of the different services that we have available to us in the area.
So can we put titles of some sort or another on the two projects so that I have a tricky catchphrase? So the first, Finn, what would you call your project?
Like I said, we haven't discussed it too much, so I'm not sure he has.
Well, I'm putting you on the spot. I'm known to do that.
Something like Radnor's bike availability or bike safety plan, Radnor's bike project, safety project.
So what's your goal? In the long run, is it an assessment? Is it what do you hope to do?
I would say, like I said, we haven't had a specific meeting yet to identify the goals. But on my end, I would just like to assess and understand how important this level of exercise is for individuals in Radnor. Understand who is biking, who is exercising, and then also understanding the impediments that they're facing in doing so. Kind of maybe if we could see the goals that they have. There's social goals, there's physical goals, there's health goals, and if those goals are being attained, and what is stopping them, what is obstructing. And if we can kind of figure out a solution there, hopefully rectify that. And I think one of the ways to do that is just increase the availability. So I think that would be the primary goal. So possibly an assessment and looking to the individuals themselves and asking them.
So is your interest primarily in bicycling as a recreational activity or bicycling as a commuting? So cities all over the world, including Philadelphia, have invested immense amounts of money in infrastructure to increase the degree with which bicycling is seen as another means of transportation, not just recreation. So is your interest predominantly recreational, or does it have more to do with bicycles as transportation?
I think from what I know right now in Radnor, at least, it is primarily recreational, but if we could possibly promote transportation, and if we could get out those benefits, like I mentioned before, the social and health, that could possibly promote more transportation, which would be great for the environment and also the people in our township's health.
So for my own severely impaired memory, if I call it bicycling in Radnor for the moment, that wouldn't exclude anything.
That's great.
All right, great. Chloe?
I'd probably call mine availability or access to mental health services in Radnor. And one way we could go about that is just identifying some barriers that might be in the way, like sometimes cost or just lack of education or knowledge that there is help out there.
All right, keeping it simple-minded, mental health services in Radnor. We good with that? For the moment. You don't have to keep those titles, but that's how I'm going to think about them for the moment. Good with that? All right, well, welcome to both of you. Thanks. It's a thrill to have you. Thanks. Anything else?
Just very quickly, I'll echo something Lisa started to say, which was that I think we were all of us who were involved in the selection process, we're all very impressed with all of the students who applied. So for those who were not seniors, we'll look forward to hopefully seeing an application from them again the following year. And for any of the seniors who weren't selected, we'll hope that they keep their interest in public health going. It was, we only had 2 slots available to pick, but we were very impressed with everybody.
Excellent. Any other questions from the board or comments? I want to thank everybody involved. It's one of our cornerstone programs of the board is the student intern program, and want to welcome you aboard. Thanks. No other comments? All right, so we're down to new business, and welcome back, Maggie. Looking forward to an update from the Board of Commissioners from our representative, Maggie Myers.
Why, thank you very much. Sorry I missed the last meeting. I
missed you.
had a little hurricane damage to my house in Maine and had to go and see what Hurricane Lee had done. Didn't end up being a big deal. But so I have a couple of announcements. Having missed the whole summer, I might leave a few things off, but we'll catch up eventually. First and foremost, I want to update everyone on something we had talked about in the spring and will be very interesting to Chloe, I'm sure, which is the involvement of a new mental health unit within the police force. This is happening. It's funded. We've hired, as of October 1st, a full-time social worker who is already getting involved in some cases and follow-up work. She does not yet have the 3 police officers that will be dedicated to this team because we're training new officers to replace those so that they can spend the full time doing the mental health work with her. She will go out on primary calls as is seen fit by the way the call comes into the police department, whether it's physical abuse, substance abuse, I could go on, but it's very exciting, and we're looking forward to collecting data on it and seeing if it's not really helpful to the citizens of Radnor Township.
So 3 veterans of the Radnor Township force have volunteered to be part of this task force.
That's correct.
And they need to be
they have to be replaced.
They need to be replaced.
So we've actually hired 5 new police officers, 3 of which will replace the 3 veteran officers, if we want to call them that, and 2 will be starting a new or helping increase the numbers of the police force so that they can do a high-risk areas of Radnor can be patrolled exclusively by these folks, allowing the regular police force to keep on their regular beats, because they were getting pulled to robberies, a lot of things in Wayne, a lot of things around the shopping centers where there are break-ins here. I mean, that does happen. It's not like it's been in Philadelphia, but we certainly have a lot of dangerous activities. And these high-risk beats will be have some dedicated officers and increasing. So we're going to have 5 new police force members. They probably won't be up and running until December. They're all hired, but they have a lot of training to do. So, and that's the one big public health thing I have to announce. The other thing, I just want to put my word out for, Radnor Township is undergoing a comprehensive plan update, which is a long-term planning for the township, everything, it's going to include everything. What I would ask of people here, and including students, is there is a virtual workshop on the website, radnor.org, and if you just spend a few minutes to go on that and complete it, it's going to be very helpful to the professionals we have advising us on the comprehensive plan. That's it.
Thanks, Maggie. Any questions from anybody?
I guess this is the appropriate place on the agenda to do this. So Maggie and I had been in contact after the last meeting about getting something scheduled with what we had talked about at the last meeting of having Savage Sisters be able to do a presentation that was presented as sort of a sponsored activity of the Board of Health or a special, non-agended meeting of the Board of Health. And I think we had to formally request space on the commissioners' meeting in order to go and present that, so I wanted to formally request that.
Thank you. You actually did, but it needed to come through this committee as this is an advisory committee to the Board of Commissioners. I will tomorrow see if I can't get it on the agenda for Monday night's meeting, so we will need one representative there to request this in front of the Board of Commissioners.
I'll be happy to volunteer. I don't know, Kiki, what your schedule's like if you wanted to be the one to present that either. Okay.
Generally, it's 6:30 on Monday, and there will be some other agenda items ahead of you, but I'd try to get you up pretty high on the business agenda.
I'm certainly available.
For the purposes of the minutes of the meeting, it's either Alex or Kiki or both will represent in that issue at the Board of Commissioners, yes?
Terrific.
So I actually have a question about the comprehensive plan. And I didn't do the workshop yet, but I've been kind of doodling around there. It feels like one of the most important things for us is our environment, and it feels like things are a little pell-mell, but how do you organize in such a way that for example, going to zero emissions would be a leadership role for the township, but we do one thing here and one thing there, and we had the Radnor 100, I guess it was, and all these programs, and there's a lot of stuff out there, but from my point of view, that would be a direction that would benefit from a comprehensive and coordinated approach. And is there something that we can do to help drive that? What do you recommend?
Well, we do have an environmental advisory council that is also a committee of, that recommends things to the Board of Commissioners, which I think would probably be your starting spot, because I think you're right. I mean, we are getting some electric vehicles in the police force. We're, starting, but it's a little here and a little there. So I think that would be the way to go, would be to contact the EAC. They have lots of great ideas. So,
do they have a budget?
Just a tiny budget, and it's mostly for educational purposes.
Okay.
And it's a new budget. Actually, they had no budget as of until recently.
Great. So, anything else from the board?
Just on that subject, we had a request at the last meeting from a township resident about keeping data for the cooling centers, and I wanted to make sure that that was acknowledged, since I know that you weren't here at the last meeting, but I believe that that they wanted to know if data could be kept on the cooling centers in terms of, I guess, how many people are making use of them.
I believe they're keeping data, but I will double check.
Okay.
I assume warming centers as well.
Yes, I believe so.
Thanks, Alex. So With that, I have agenda item for school board update and PT. So you guys have already been stars of the show already. That's a repetitive redundancy, by the way. But is there anything operational from the school board that you'd like to bring to the attention of the Board of Health?
Sure, just real quick. RTSD is hosting flu clinics again this year. Actually, today was the middle school. Last week they had hosting a clinic at the high school, and then next week, or tomorrow rather, the 19th, no, Thursday, they'll host one at Radnor Elementary. In terms of a health update, just to kind of piggyback on what you said, Doctor, we are not seeing, anything out of the ordinary. No confirmed cases of the flu, some COVID here and there, but nothing out of the norm. A lot of respiratory viruses seem to be running around, sore throats and headaches, but just the usual suspects for this time of the year. And then just, again, to reiterate what Ms. Carroll said, students in grades 6, 8, 10, and 12 will participate in the Pennsylvania Youth Survey on Monday, November 13th. And I think we already discussed that. And that's pretty much it. Thank you.
Thank you. Is there any other new business that anybody on the board would like to bring up?
Just very quickly, I did want to acknowledge that it is Breast Cancer Awareness Month this month. I know that unfortunately in this country, I think we sometimes have a little bit of the tendency to treat diseases like memes, and there's, the trendy ones that are kind of always in the news, but breast cancer still affects 1 in 8 American women at some point over the course of their life, and it's 1 in 8 cancers that happen in America, so I did just want to acknowledge that.
Thank you. Any other? With that, I'll open the floor for public participation. Any of our guests have comments? Any other comments or concerns? All right, then I'd ask for a motion to, second? I'd ask for a motion to adjourn.
I'll motion to adjourn.
Second? By acclamation, the meeting is adjourned.
Maggie.
Just for people's, the board has an executive